Folks, thanks for tuning in with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing the marketing of a subset of the Medicare Advantage plans, the Special Needs Programs. Today's program is being recorded, and it, along with much of the material that we referenced throughout the course of the presentation, will be sent in an email follow-up to all who have RSVP'd to today's presentation. Please keep in mind, because I blind copy that communication and it has attachments, it periodically will be pulled in the spam filters, and we'll address that should that happen, because these normally go out within a day or so of the presentation itself. If you would, please make use of the software used to present this presentation. In the question section, put any questions you have about this topic as we go along. Please keep in mind that many of those questions are normally addressed through the course of the presentation, but we'll make certain we answer all unanswered questions at the end, if for no other reason to say, hey, I got to look into it and I'll get you the answer. A bit of background to start about our organization for those of you who may not be as familiar with Premier Marketing. We are a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, offering insurance programs through independent insurance agents such as yourself. And those contracts to independent agents are at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so we've recently achieved a milestone in our history, our 50th anniversary. And we consider that quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the insurance world, particularly in the Medicare space. We do so through a full portfolio of products that include the base Medicare programs to help with what base Medicare doesn't cover, including Medicare Advantage and Medicare Supplement programs, standalone Part D prescription drug programs, but also through a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need programs, long and short-term care programs, disability income, and ancillary benefits such as dental, vision, hearing, critical illness, cancer, and hospital indemnity programs. Those Medicare Advantage programs include all the national carriers and many of the strong regional carriers that make a difference for you in your market, with that same philosophy carrying over into the standalone PDP portfolio, where the national carriers are available to you through our organization. Our Medicare Supplement portfolio is very robust, including a couple of gangbuster new additions to the portfolio with name brand carriers, with support programs put in place to help you be successful in this space as well. When you look at the ancillary products in each of those categories, those leaders in those areas are available to you through our organization. And these programs make not only a strong addition to an individual's coverage to help cover what the base programs don't, but also give us as agents a prospecting tool and another means of increasing revenue for our agencies while serving our prospects and clients. When we look at the Medicare space overall, you don't get on a presentation like today without hearing of the silver tsunami, the aging of the baby boomers, 10,000 people a day, one every 10 seconds. Well, if you look at Medicare based on just age, you're not seeing the entire picture or a clear picture, because there are a number of individuals who will not immediately access their Medicare benefits, even if they qualify at the age of 68 or 65, deferring that coverage until later. And there's a big portion of the Medicare population that's not age-related. They access their Medicare benefits because of disability, and it's nearly 1/6 the population of the Medicare space. So if we want to look at a true picture of the market we are serving, this disabled population makes a strong addition to the Medicare space and is of particular interest when we deal with the topics of today's discussion, those being special needs programs. Diverse population. We need a diverse portfolio of product to address it, not only to accommodate the needs of care for their chronic conditions, because 2/3 of the population has 3+ chronic conditions, but also it's a great way to address the financial uncertainty of a possible claim, because, well, there's income and assets challenges for half the population within this segment as well. And it just increases as we age or get deeper into the system. A big portion of what we look to do with some of the special needs programs, at least one of the two that we discussed today, is dealing with the financial ramifications of the past and how we can help people regardless of some of the income challenges that they may have. Because when people join Medicare, obviously they have choices. An old sales manager of mine a long time ago used to say, the decision to make a decision is a decision. And that's true. So people have choices as to what they're going to do. Are they going to completely self-insure outside of Part A, not even pick up Part B or a drug program under Part D? Or are they going to go into the programs, look for assistance with those additional costs through a traditional standardized, modernized Medigap, Medicare Supplement program, or enroll in the private administration of the Medicare benefits through the Medicare Advantage program? When they choose the latter option, we then go into the category that we speak of today and the subset of the special needs programs. Just keep in mind, when people are first eligible into Medicare, and that includes the age-ins or the people picking up the coverage later in life, it's a pretty even split to start between Medicare Advantage and Med Sup, and there's a portion that appear to choose to do nothing, according to this graphic. Keep in mind, that graphic may have coverage provided through the Veterans Administration, through Medicaid, retirement programs, a number of other things where that may not be just original Medicare. But it gives us an opportunity to discuss the options that people have and what may be the best choice for them, because they're all different, much like all of us. We don't walk into a doctor's office and just get a shot or a pill without the doctor asking questions, doing some tests, determining where we are with the challenge we have at that point in time. It's much the same procedure we use in a way as agents with our prospects and clients. We ask the questions. We go through and determine what may be the best way to address the needs they have, and that varies from individual to individual. And because sometimes Medicare seems to have its own language, we have a secret decoder ring for you as well. I would send this as part of the regular follow-up to today's presentation, but the guide is very large, and all of the pieces won't get through the servers necessarily. But if you're interested in the acronym decoder, let us know, and we'll make certain that we get that to you as well. So when we speak to marketing special needs programs, it's important to note that regardless of the type of Medicare Advantage program that comes into play, there are only certain times when a person can enroll. Most folks who have been in the Medicare space are aware of the annual election period and the OEP as well that just finished up. And they're also aware of some of the other special election periods that come into play. One of the reasons that special needs plans have a particular elan, a particular attraction throughout the year, is they are in many circumstances qualifying for a special election period directly specific to the programs that they represent. There are a number of other special election periods as well. In addition to the standard ones, we have an additional one for the weather challenges that we've had, and then of course the COVID-19 SEP for those that have that condition that prevented them from making an additional choice during the first part of the year. So there's a number of different circumstances that can come into play for us at this time. This speaks to the weather SEP that I mentioned. And then when we look at special needs plans overall, a bit of background would be helpful. These are actually programs that were created by an act of Congress back in 2003 by the Medicare Modernization Act, and have been reinforced by different legislation since then, both financially and with the programs being more widely spread than they had been in the past. There are different types of special needs plans. We'll address those, but These programs limit their membership to people with specific diseases or characteristics, and they tailor their benefits, provider choices, and drug formularies to best meet the needs of that specific group. That's why you see in the space now many of the non-medical benefits that have become available over the last couple election periods, most prominently displayed in a special needs program more frequently than a regular MA program. 3 types of SNP programs. The first one addresses chronic special needs programs, and these are for people with certain health conditions. You see a listing of a number of health conditions, but just because a medical condition may be a root source for a special needs plan doesn't mean there's one out there with that. A lot of folks will look at cancer programs. I'm not aware of a special needs program anywhere in the country for just folks with cancer. So there are different things that, while there may be a disease that would be a basis for one of these, it doesn't mean that plan is available, and it doesn't mean these plans are available in every market. It varies across the country, and I think we'll see that as we determine what is available for you in your market. The second type of special needs program deals with an institutional SNP, and these are for individuals who live in an institution like a nursing home or require nursing care at home. As independent insurance brokers, this is a program that may appear to have a bit of interest, but generally is not available to the broker community. Generally, its sales are restricted to captive agents or employed agents of a particular insurance company. Keep in mind that may not be as big a loss as you might think, because in most circumstances, the network of an institutional SNP deals with the medical staff at a particular institution. So it's not like every nursing home in an area qualifies for an I-SNP anyway. And then, of course, the third type of special needs program deals with what we refer to as dual beneficiaries. These are folks that have both Medicare or Medicaid coverages and are not dictated by health circumstances like the chronic SNP is, but deal with income and assets restrictions or lack thereof. So those are some things that we'll dive into with some intensity. When we look at the C-SNPs, to become involved with or enroll in a chronic special needs plan, the consumer has to have Part A and be entitled to Part A and enrolled in Part B. They have to have a specific chronic condition for that specific SNP plan and have that condition verified by a physician. They need to reside in the service area where that plan is offered, and they cannot have end-stage renal disease to become involved in one of these programs. As a corollary to that, however, there are chronic special needs programs in certain markets that are aimed at the ESRD population. In some markets, they are commissionable, and some they aren't. So that's an important consideration as well. If an individual has a chronic condition and wants to join a chronic SNP, they can do so at any time. The SEP that's there is available once a year for a particular health condition. However, we noted earlier that 2/3 of the population has 3+ chronic program or 3+ chronic conditions. An individual may very well qualify for more than one chronic SNP plan and has a special election period for each of those conditions of plans that are available in their market. That's why you will see some movement more than once a year with a chronic special needs program. These coverages begin the first of the month after an application is submitted for that individual. They have a specific time period in which they have to have their condition verified by a physician in order for the plan to go into full effect. Now, because these are limited to qualifying individuals, they concentrate on services that are medically necessary for these members by offering specific health provider choices, including docs that specialize in a particular illness. They tailor the formulary to address those needs. So you'll see different chronic special needs programs for diabetes have different types of coverages for insulin and those sorts of things. And these individuals also have to have, as part of a SNP program, a professional care coordination service with guidance to help deal with those diseases. One of the things that you will see as well in a SNP program, and pardon me while I go in, before I go into the rest of the slide, is the fact that a SNP program will have the prescription benefit integrated into the program each time. So it's not like a Medicare Advantage plan, which may be Medicare Advantage only without the prescription drug and opt out, or a fee-for-service program that gives them a opportunity to pick up a different Part B plan. So that's one of the things that you'll see in these programs. As I mentioned a bit earlier, but going into further detail, 2/3 of the population has 3+ chronic programs. 90% of the seniors have at least one chronic condition, and 77% have 2 or more. Plus, we have the aging in of those individuals, and then the dual beneficiaries that represent 20% of the population. So you have a huge number of folks on Medicare that may well qualify for a special election period because of these SNP programs. You look at some of the most common chronic conditions, these are many of the conditions that are addressed by a C-SNP program. Most frequently, cardiovascular challenges, diabetes are the most common. You'll see some pulmonary pieces in there as well. And then I did mention some of the challenges that folks have with their kidneys through the ESRD. Medicare itself gives us some information on how to address some of these specific underlying conditions. This is a nice piece that they put out on the Medicare U coverages on diabetes. It gives us as agents the information we need to help compare what a person has on a just regular Medicare and what they would have by comparing it to the benefits in a special needs program. Same sort of thing for heart disease is available to you. Those are active links, by the way, if you want to go through them. So you have a bunch of different information available in the chronic special needs area. When we look at the dual special needs eligibility, we're dealing in many circumstances with folks that do have chronic conditions, but they are also limited and qualify for this type of program because of a lack of assets or income. These folks then also have some specific information designated to help them with this, finger quotes working, condition. And one of the most frequent things that we'll see in these circumstances are some of the extra benefits that are available, like over-the-counter benefits sought out of a catalog or at a specific pharmacy, transportation benefits, some assistance with other areas that are driven by dollars. This also gives individuals additional assistance on the cost of medications, because in order to qualify for many of the DSNP programs, the income and the assets are such that low-income subsidy, extra help comes into play. And as you may recall from previous webinars or from webinars we'll attach to this presentation follow-up, is those lower incomes affect the cost of the plan and of the medications involved. So it can be very helpful for you in this circumstance. There may be folks that qualify for a C-SNP program that can get help with the cost of their medications as well and not qualify for a D-SNP because their income isn't low enough, but some different things can come into play. To be able to enroll in a dual SNP, the consumer must be entitled to Part A and enrolled in Medicare Part D. In order to qualify for full assistance, they normally have to have a minimum of a certain level of assistance. That's normally a QMB or QMB plus status. We'll talk about those in a bit. They too have to reside in the service area, and they cannot have end-stage renal disease either. There are some exceptions, but in these circumstances, the special election period for these individuals changed at the beginning of 2019. It used to be a continuous special, continuous special election period where they could change plans each and every month should they choose to do so. That was changed effective the 1st of 2019 where they then have an election period once in each of the first 3 quarters. That's why with these individuals, much like anyone else, you want to be able to be knowledgeable of the requirements that are necessary for qualification, but also have access to those that can help you determine as to whether or not that special election period has already been exercised for that quarter. Most of the large carriers have a agent assistance line that can help you with that, to help you determine the level of assistance a person is qualifying for, and whether or not they've already exercised that special election period for the quarter. As I mentioned, that's a difference from the past, and there are some individuals that seemingly qualify for a dual or LIS SEP that may not be able to access it because they're considered at risk because of some of the medications they're taking. That's why having that relationship and the knowledge of different health programs and how to determine whether or not somebody actually qualifies for that step is paramount in working effective in this portion of the business. So it's important to note too that they have further subsetted out this special election period for those who have been auto-enrolled in certain programs and for those who have had a change in status. So these are steps different than the regular dual LIS special election period, but that's one of the reasons why we want to access those assets we have from the different carriers that help us determine the difference in these programs. One of the things that we see as well is, well, gee, if they can change with us once every quarter for the first 3 quarters, doesn't that mean they can also change away from us once? Yeah, it sure does. But what we see is generally this area is not marketed as heavily as the regular Medicare Advantage area. You'll find some agents will actually stay away from the dual area because the folks are of limited income and cannot purchase any other type of program, and that doesn't fit their marketing structure. But generally, if someone is switching as a dual individual, it's generally because another agent is speaking to them or a provider of some sort is. So that's one of the reasons why we want to be very thorough in our presentations. We want to make certain that we put our arms around everyone involved in that decision, be it a family member or a trusted provider. And we want to make certain that we're covering our bases because we're not in this for the short haul. We want to make certain that we help people on an ongoing basis and also keep them in our book of business. Some things to consider is in many circumstances, a person can qualify for a dual SNP without being full-blown Medicaid. Medicaid individuals are 100% of federal poverty level or below, and these programs, Medicaid, can be different for those that are active in the community versus for those that reside in a nursing home. And numerous discussions with agents who say, well, this guy's in a nursing home, he can't have that much. Well, yeah, plus you don't necessarily want to market a true dual SNP program for a person involved or living in a nursing home because of network constraints in many circumstances. MSPs, these are Medicare savings programs that can give you the information as to whether or not a person will fully qualify for a dual SNP. There may be circumstances where you can enroll an individual in a dual special needs program based on one level or another of a Medicare savings program, and their out-of-pocket could conceivably be much higher than a regular MA program based on that level of assistance. So we want to make certain that we're doing not only the right thing in evaluating programs for an individual who has an opportunity to change plans, but also making certain that we're looking at an entire portfolio of products so we can basically make certain that we're doing the best thing for our prospecting client as well. In certain states, a Medicare savings program may be called something different than it is in another state. Lipstick on a pig, basically. There are some different qualifying factors in certain areas, but if you work this area with any frequency, you'll become very familiar with the names that are associated with these programs. And obviously, the differences from state to state, that's where relying on an organization such as ours and on the carriers with whom you contract in order to make certain you have the information you need on these programs to do this job correctly. Some of those different levels of assistance, I referenced the QMBs, the QMBs, the Qualified Medicare Beneficiaries. This is a program that pays the Part A premium if applicable, Part B premium if applicable, any penalties for enrolling late in those programs as well, and also pays Part A and B deductibles, co-payments, and co-insurance in most circumstances. So this is the most comprehensive of the Medicare savings programs and is the one generally that's the minimum qualification for most DSNP programs in order to maximize the benefit of those plans. You have a couple of additional levels you run across more frequently than a fourth. The second is a specified low-income beneficiary, a SLIMB, and this is a program that pays only the Part B premium at $144.60 only. When you're at that income level, that's a huge chunk of change and a huge difference in a person's monthly benefit or actually income if you can help them get this coverage and they don't already have it. The same sort of benefit comes from the qualifying individual, the QI1 program, which pays the Part B premium as well. These came about in 3 different pieces of legislation through different times in a widening of the assistance programs in this area. Who are eligible for these programs? Well, these are folks that they've got to have Part A, and they must meet certain income and resource eligibility tests. The financial eligibility guidelines are set by law, but the states can raise or eliminate these tests. Generally, we see the same income standard in 48 of the 50 states. However, we have 8 states that do not have a resource test. So if you're working with an individual that moves into your state and your state is not one of those 8 listed and it has a resource test, we can't automatically assume that individual is going to qualify for this assistance in their new state as they had in an old one where it didn't have a resource test. Found that out the hard way a couple of times myself. Generally, these applications are submitted through the local Medicaid agency, many times housed in Social Security offices, which right now, because of COVID-19, are closed up. But an individual can start this process by completing the extra help application, which is available online. We'll talk about that more in a bit. And the eligibility for these programs are generally redetermined each year. In the past, we've seen numbers for these programs come up basically in April or even into May. This year, and some of the more recent years, we're seeing those determinations come out much earlier, so we have 2020 numbers. When you look at the history of these programs, I mentioned they were created by 3 different types of legislation. They are, however, in each of these categories, you'll notice that a majority of folks that qualify for them don't have them in place for one reason or another. So our being aware of some of the basic numbers can help these people get the additional assistance, can create that widening of your prospect pool, the deepening of your prospect pool by helping folks get qualified for this help. And the difference and impact it makes in their lives is nearly immeasurable. You also have to deal with, in certain states, Medicare Medicaid plans, MMP programs, which are, in most circumstances, still a pilot program in certain states where the governments, the state and the federal governments, are combining Medicare and Medicaid plans into a singular program. And this eliminates us as agents in those areas for these programs because they're administered by the government and not sold by agents such as ourselves. So if you're in one of those particular states, it doesn't necessarily affect every county in every state, but we need to be aware of them, and it's a little extra work to make certain we know what we're talking about in these areas. Because in addition to those MMP programs, there is a big change toward managed care within Medicaid plans as well. We're not selling Medicaid plans, but it can affect our ability to sell Medicare DSNP programs in those areas and get paid for them. For example, in Texas, 254 counties, there are 6 counties that are in that dual demonstration project that makes our work a little more Well, we got to have more detail on it, because if we are selling a plan of a company who administers the Medicaid benefit in a particular area, it may not be commissionable. We need to watch our dot our I's and cross our T's in that circumstance. In Texas, that managed care program for Medicaid is called Star+. Once again, as I mentioned before, in different states, it has different names. We got to make certain we know what we're talking about. In Texas, it's now managed care in every county in the state. Specific information for Texas attendees, we'll get that for you upon your request as well. How do you find out where a program is? Well, for all the challenges that the Medicare.gov Plan Finder had this past fall, it is still a great tool to help determine where these programs are. So we go to the website and we look for health plans and deal with the current offerings that are available in our market. We then go into that area without logging in just to see what programs are available. It gives us an opportunity to lay out what we're looking for specifically, and it tells us the number of plans that are available in a particular zip code. It also gives us the subsets for those special needs programs. And you'll notice the dual special needs program referred to plans for people with both Medicare and Medicaid, plans for people with chronic or disabling conditions, and then long-term care or institutional SNP programs. So this is where you can see some specialty listings of the special needs programs, and it'll designate it for you here in this example in a Collin County offering by United Healthcare. It's offering a chronic special needs program. If this was a dual special needs plan, here's a wonderful revelation. That'd be a D instead of a C. So it'll tell you what programs are available where. We can go into Medicare.gov and pull this up live. For the sake of time, at this time, we'll skip through that. But you also have another website that can help you determine where these programs are as well, the Q1Medicare.com website. This is actually powered by an insurance brokerage firm, so there are certain things you got to be careful with it in order to make certain that you're getting information and not inadvertently enrolling someone and not getting credit for it. But it gives you the information on all sorts of programs, including the different SNP plans, what's available in the states, the areas in which you're marketing. The big secret to these programs is being knowledgeable and having completed our preparation. It's very important to know the ins and outs of the plans and of the networks, because that's one of the things that you will find makes a big difference in what may be the best plan for one individual versus another. In addition to those ancillary benefits, having knowledge of specialists, hospitals, the primary care folks, what are the differences in some of the co-payments? How are the medications laid out? What is on one formulary offered by one company versus the other? And then knowing of the assistance programs that help people qualify for or enhance the benefits of the programs they selected. Because keep in mind, that extra help program, that low-income subsidy LIS, it's not indicative of any one carrier or not pertinent to just any one carrier. It applies across the board, and it generally is a great help in lowering the out-of-pocket exposure for a person in whatever plan they take. Say the average value of that is over $4,000 to the beneficiary each year. The Medicare savings programs, well, there are certain dual special needs plans that don't require a QMB level of assistance in order to be fully effective. Not very common, but in certain markets that does come into play. And so we need to make certain that we know exactly what one company can do, what one plan can do versus another. And in each of those markets, as designated here by Star+, we need to know of those demonstration programs and how they can affect our ability to work in the dual special needs area as well. Some things that come from long experience in this area, if you work the dual special needs market, be prepared for a longer appointment. You may have to repeat yourself The education level of a lot of these beneficiaries may be lower than some of the folks that you visit with. I'm not implying they're stupid. I'm just saying we need to make certain that we are speaking to them at a level that is comprehensible, and we don't find ourselves falling into the use of all those acronyms that I mentioned much earlier in the presentation. It's also important to work with decision makers within the family and making certain that we realize that if we don't do our homework and track through some things, that SEP, that helps us enroll people and help us lose people as well. It's also very important to note that because there are, in many markets, a pretty good number of these programs available, and you may not contract with all the carriers, or some of them may not be available to the broker community, as I mentioned before. It's important to know the carrier that you're representing, or carriers, and work with their personnel and staff. Most carriers have agent managers in the field that their pay is dictated on your production, so make use of them. Make certain that any collateral material that you can obtain, both in selling material and in marketing material, because they have, in many circumstances, additional marketing material and budget available in these areas, that we make use of them and that we attend their trainings, be they online like this one or so many others. But in many circumstances, carriers, once we receive a return to normality and we have face-to-face trainings, they do them with some frequency in most markets as well. We also have, in addition to that carrier information, governmental support material available too, and that is some of the information on how to access that will come in the follow-up to today's presentation. Just to beat it to death, double check the extra benefits, the dental, vision, hearing, transportation, over-the-counter. There's a chronic special needs plan here in Texas, in Central Texas, that offers help with air conditioning. It's for folks with cardiopulmonary disorders. So there are different things that may be a special needs or a special attraction to a segment of our population. It's also important to note the providers across the board, wherever they're accessing care. Because remember, when someone joins a network-based Medicare Advantage program, and that's what the vast majority of special needs plans are, it's all providers of care within that segment for that beneficiary. So for durable medical equipment carriers, home health care carriers, all those different areas that we need to look at besides doctors and hospitals and drugs pharmacies, in order to make certain that we are addressing all the needs that are in play. Because this is an area where if you go in and you enroll someone on one of these programs, they have home health care in play, even if it's paid by Medicaid and not Medicare. That provider may not know how they are being funded, and you might wind up with a disenrollment by not asking one additional question. Plus, it is super important to take advantage of the carrier support that's available. You see a much larger number of carriers offering these type of programs now, and a diversity of assistance in those areas. Some may well have co-op programs available to you if you work up a plan as to how you're going to market consistently and what you anticipate as a return in membership as well. So it's Pepe Le Pew dealing with Penelope. You never get kissed if you don't ask. Walk through some things and see what support's available through all available sources. You have a number of different resources to access additional information on these programs and make use of it. There are tons of things out there from the government sources, from National Council on Aging, from different players involved in this space that can be invaluable to you in not only better understanding the programs, but also how to use material available to you without cost in order to more properly market or more effectively market these programs. Remember I mentioned government supplies with different pieces? This products ordering CMSHSS.gov website, that is one of those sites I was referring to where you can go in there and order material without cost with certain quantity limits that can help you market. I would strongly recommend making use of all of these materials that are available to you. In addition, the vast majority of carriers now have the opportunity for you to use one of their marketing sites to personalize information with your contact information on it. Using that in the community is invaluable. We can also help you with certain tools that will help you fill in gaps in many circumstances. This particular tool, when you look at perhaps more in the Medicare Advantage space with the chronic special needs plan, designating that plan, if they already have it in place, or if they don't, utilizing it with a fill the gap type of scenario with a hospital indemnity program, or perhaps some additional dental coverage, will help you not only enhance their coverage, but generate additional sales as well. It's also a tool you can use to harvest those electronic scopes of appointment and store them for that 10-year period that you're required to by law as well. Keep in mind, that 10-year requirement's not if you just sell them. It's if you show the product, even if you don't sell them, you need to store that e-scope in this or another program and reference it throughout the future as well, because people's circumstances change. So remember, it's important not to put all your eggs in one basket and realize that not one size fits all. So use the programs that are available to you to help determine what is marketable in your area, and then do a deeper dive into those choices to make certain that you can explain them on a year-over-year, presentation-over-presentation basis. Keep in mind this tool, available to our contracted agents without cost, the Medicare Center program, not only helps you collect an electronic scope like the other quote engine does, but also allows you to enroll remotely. You'll see in the chronic space a wider distribution of folks that have access to email or the internet and those sorts of things. But even the dual population, because of some of the assistance programs on phones and other things, they are increasingly adept at handling things electronically. And at this point in time, when we've got to reach out and touch people without touching people, having electronic access to deliver the information and enroll remotely and electronically is paramount to our success. Keep in mind, these systems not only help you enroll, but they help you retain that book of business as well year over year. And also gives you, of course, an opportunity to cross-sell. You do also have other programs outside the Medicare arena that can help you with folks with different chronic conditions. This is a guarantee issue life product that is handled by another department within our organization, but can be very helpful for you in this area as well. When we send out the follow-up, if you have additional interest in this, we'll make certain that we get your information to folks that know these programs and can get you the information you need on this version of helping people with chronic conditions. Some additional things you get from us here at Premier, obviously, if we're going into areas and we see multiple SNP programs in an area, do you want to contract with them all? Well, I suppose you could. It's going to be a lot of work. You've got to do certification for each and every one of them. However, in many circumstances, it requires in all circumstances, it requires a contract for each of those carriers. This program can help you set up an agent profile and electronically fill in many of those contracts without having to physically do so. So utilizing SuranceBay can help you qualify to contract with multiple carriers without filling out multiple contracts. We also want to protect your business, so offering discounted errors and admissions coverage to agents that contract with us for at least one contract. Give you an opportunity to buy this discounted E&O that covers you regardless of your upline with different products. You realize you're an independent agent, you may contract with a number of marketing organizations. This program doesn't add you to one blanket E&O policy for one program. It's your owned policy that gives you the opportunity to cover yourself regardless of who you contract with. We carry that, we carry that same philosophy over into maintaining your license as well through CE bundles, continuing education bundles, through our relationship with WebCE to keep your license in play. And you can add to your own benefit package through participation in the modified guarantee issue DI program for yourself, available at discounted rates. You get paid a commission on it as well, something to do to enhance your own benefit package. Much as where today's presentation is being recorded, we've done different presentations as well that do deeper dives into those subsets of chronic and dual special needs plans. So a program specific to one carrier with DSNP or a general DSNP overview is available for you as well. Same thing with chronic special needs programs, but also different insurance programs by different carriers across the board. Additionally, we make available different programs that help you market specifically as well. One of the programs that's popping up here in the next couple weeks again is the Raising of the Hands for the Walmart program for this coming fall. Yeah, I know it's just April, but it's pushed earlier all the time. Right of first refusal for those folks that have been active in that program is going on now. And so we'll have additional information on that coming to you very quickly too. Please make certain that you make use of all the e-app material that's available to you. Not only do we offer two very strong programs that give you access to electronic applications, but many of the carriers have strong programs on their own that give you the opportunity to not only be active at this point in time, but also effective and efficient in completing applications electronically with the people you're visiting with, even socially distantly. So again, not only the CSG piece, but that Medicare centerpiece. And if you are active in other areas in the insurance world outside of Medicare Advantage and PDP programs, many carriers offer additional incentives to work with them. And those incentives also carry over to our own producers convention, which this year was going to be a trip from Miami to Bahamas. We all know what the world's like right now, but watch for next year's information. We can help you get in front of folks as well. If you are an individual who has a strong relationship or likes Ma Bell, Smile and Dial lists are available to you, butted up against Do Not Call. Those contact lists are available to you at a discounted rate or at no rate at all, depending upon your contracting situation, and are available to you. There are certain programs that allow you to cold call. Of course, SNP programs are not one of those. You can't cold call for a Medicare Advantage special needs program. There are certain things you can do to get your word out into the community about you, though, and that includes many community-based programs, including the retail programs that I briefly mentioned a moment ago, and also working through other centers of influence, such as faith-based organizations or providers that deliver the care that you're offering now. Keep in mind, these organizations are facing some of the same challenges you are with, boy, I can't kiss some babies and shake some hands and get elected physically here. Doing some things electronically at this point in time with these centers of influence can make all the difference for you moving forward. It's a great way to maximize the time you have available by reaching out to these folks and letting them know that you are a resource for the people they serve as well. And some companies will generate prospects for you at this point in time too. If you watch any sort of off-brand TV, so to speak, I'm a big Western channel guy, boy, every other ad is talking about Medicare products, and they're kicking out different programs to reach out to those individuals. Carriers are doing the same thing, and if you're working with some of the Medicare Advantage carriers very closely, they may have different ways of assisting you in that area as well. We do also have Facebook lead programs, different internet lead programs available. Program for final expenses, strong and proven. The Medicare version just rolled out, so data is still out there, but the initial returns are very strong on it. And we do help people with direct mail support too. It's based on production, but it deeply discounts the cost of a proven way of getting in front of people. And we're seeing people across the board see increased response off direct mail even now. Much as where the internet leads are very active and near instantaneous, this has a little lag time but responses are actually up during the time of social distancing. All this said and done, we've got a number of different programs out there that can help you get additional information from our organization and work hand in hand with us. We want that opportunity to work with you in this area, lend our expertise and our assistance in helping you make this a part of your overall marketing system. Because it's easy to see results, sometimes it's difficult to realize the things we got to put into it to make it work out. It's up to you to determine if these programs are a viable part of your overall marketing plan. I would recommend to anyone, if they're involved in the Medicare Advantage space, even if you choose not to look specifically at targeting these two areas, that you be very aware of these programs, because you'll run across individuals, and if you're not prepared to address them, someone else will. So if you're not selling it, someone else will be selling it. Well, yeah, it is. That's the truth. Make it a part of your program, study it, become aware of it, and move forward with it. I'm going to look at some of the questions that have come through in the meantime. Only a couple that weren't addressed during the presentation. One is, will a C-SNPer lose their PCP due to joining the program? Depends. Don't mean to be wishy-washy, but if that PCP is part of the network, no, they won't. And that's one of the ways that many of folks will work the C-SNP programs, is working with providers they're working with already, making them aware of the program that allows them to change coverage throughout the year and the advantage of a chronic special needs program, and they won't necessarily lose their PCP in this circumstance. What you see in these areas, however, is much as with a person with disability accessing Medicare prior to 65, we've got to make certain that they are aware of systems limitations when it comes to network in certain circumstances, and make certain that they realize that there are times where it's a choice between the plan and the provider that they're currently using. The care will be there. It's not necessarily with the person or provider they're actually accessing now. But losing a PCP just because of joining this program isn't a foregone conclusion. So that's the other one, was a reiteration of that question. Sorry, Steve, as I mentioned during the presentation, we're looking to cover them at the end because they are generally covered. You can reach any of us here at Premier through the toll-free number at 1-800-365-8208. Our marketers are all remoted, but we're all tied in as well, much as any other part of our society right now, except the poor people in restaurants. God bless them. You can reach us through that toll-free number or through our website at premiersmi.com. Watch for the follow-up that will come out shortly when the recording of today's presentation updates. It will be sent to everybody. Please check your spam filters as well to make certain we get it to you. If you don't get it within a day, drop me a line, john.dubas@premiersmi.com, and I'll make certain that we send it to you individually and directly. All that said and done, I realize that your time is your most valuable asset. We appreciate the investment of a portion of that asset with us here today. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so very much. We'll talk to you soon.